how's it been going? I know it's a big transition, and you've jumped in at one of the most challenging times for hospitals and for the country uh, in anyone's memory. So I know that's been a lot to take on.
Absolutely. I would not recommend to people moving and starting a new job in the same year that there's a pandemic, especially if you work in healthcare. That said, I feel really grateful for a couple of things. I feel really grateful that I joined the association around the first part of the year. So I had some time in the community and with the team before things got really difficult in March and our work lives just changed. So I feel really grateful for that. I feel really grateful for the collaborative spirit of this state. I feel confident that good decisions have been made. Now, there are certainly decisions I might disagree with or I might have done differently, but overall, this state has come together and has made the necessary decisions to try to minimize the impacts of this pandemic. We are not out of the woods. We have a long way to go. There have been times when our case numbers were on the wrong trajectory. But overall, if you look at the performance of Oregon compared to other states, we're doing okay. We're doing actually pretty well. And so I think there are opportunities, even in this time that's been certainly really challenging, to look at the positive things that have come out of this and to be grateful for the things that have gone really well.
Well, and I know hospitals in Oregon have been good partners all along. So let's talk about that a bit, just because at the beginning, as most people know, there was a voluntary pause of elective procedures. So talk about that process with you and the members and the impact of that, and then how that has gone moving forward.
Sure. So we had to make some really difficult decisions on a really compressed time frame at the beginning of the pandemic. Early on, we were in close touch with our counterparts in Washington State, and they were really the first hotspot in the country. Seattle was the first hotspot, and they told us that they were running out of personal protective equipment and that we should be very cautious and very diligent about preserving what we had. So we tried to learn lessons from day one from those who had experienced this before us so that we could make the best decisions possible. So from that, we supported the governor's decision to put a pause on elective surgeries to conserve personal protective equipment for our caregivers who are responding to COVID-19. That was a difficult decision. It had absolutely significant, huge, massive financial impacts on our institutions, but we didn't make the decision because of financial impacts. We made the decision because it was the right thing to do at that point in time, given what we knew. So since then, we have found that we can keep employees safe using some PPE conservation strategies. We're very confident in that now. We're confident in the safety of our workforce. And we've been able to resume necessary care for Oregonians. So we've been learning lessons all the way through this. And I think one of the challenges of a pandemic is so much is unknown. And you have to assimilate a lot of information and make decisions really quickly in order to have the best outcome for your community. So in some cases, we may look back and say, we would have made a different decision. In some cases, we're very confident that it was absolutely the right thing to do. But overall, I think it was, again, based on the information we had at the time, the right decision. But now we know we can keep our workforce safe, and it is absolutely critical that people continue to get care, because one of the things we saw when we delayed elective surgeries is that people delayed necessary care, and sometimes their outcomes were worse.
Oregon's been very fortunate in not having lost any rural hospitals in the last few years. How does that look moving forward? And then how important has the federal aid been, and how are those rural folks looking?
So if you would have asked me this question in May, I would have said the situation is dire. We had some hospitals very close to the brink of financial solvency during that time frame. Since then, we've had federal funding that has come through, some general federal funding for all hospitals, and then some specific funding just for those rural hospitals that has helped tremendously. So I would not say that anyone's on the brink of closure or on the brink of financial insolvency right now, but this is not over. And we're going to keep a pulse on the financial health of our hospitals moving forward because we don't know what the fall is going to bring. We do know that things have improved dramatically since that April and May timeframe, but it's too early to declare, victory on that count and to say that hospitals are going to be just fine. We'll see what the coming months and what the coming months bring, and be in a better position to make that assessment.
Hospitals are obviously a place where care is delivered to those who need it, but during something like a pandemic, hospitals are also and always are sources of information and data and the sort of information that the state needs to try to manage and get in front of this and manage the pandemic. Describe the process and the collaboration with OHA and whether there was ever any decision to be made about how forthcoming to be with this data.
I think that that's the transparency has been incredibly important during this pandemic. It's important for the public to understand the trajectory of the pandemic. I think OHA overall, they've gotten some criticism for it, but I think overall they've done a good job in being transparent with information for the public. We've worked really collaboratively with OHA to try to provide the data that goes into some of those reports. And that sounds like an easy thing. Data is super easy till you try to do it. And then you realize the complexity of trying to provide good, valid data that is consistent over time. And so we're continuing actually to work with OHA on refining and improving and creating better systems for reporting that data to OHA so OHA can report it to the public. So there's been strong collaboration with OHA on that. But I want to highlight some other areas of collaboration too, because I think that this pandemic really shows an example of how hospitals and other community partners can pull together to respond to events like pandemics or natural disasters. There's been tremendous regional collaboration between hospitals, whether that's in moving patients, talking about preparedness, or even how do we make sure that patients who need it have remdesivir, which is one of the few drugs that we know can be helpful. So there's been new opportunities for collaboration and strengthening of existing partnerships through this pandemic that I think will serve us well in the future. Again, I'm always trying to look at, the situation may not be great, but what are the things that are positive, and how can we build on those things and learn from them going forward? And I think the kind of collaboration we've seen between hospitals and with the state is something we can build on for the future.
And I think there's a lot of examples of hospitals, as you mentioned, being really nimble and embracing new things by necessity during this period. What are some of those examples that you can talk about?
I think the most striking example is telehealth. How rapidly hospitals, and especially in the clinic environment, moved from almost every visit being an in-person visit to almost every visit being via telemedicine. And we all knew the promise of telemedicine, but it really took this event to accelerate that transformation. And I think there are patients who are happy that they don't have to go sit in the doctor's office anymore. There is efficiency through telemedicine. There are still some regulatory and payment barriers that we're going to have to work through if we're going to keep hold of that progress. But I think that's just one example of how hospitals moved quickly. Another was at the beginning of the pandemic, we didn't know if and when our hospitals would be at capacity. And there was some very rapid surge planning that had to go on. Everything from how do you quickly turn another unit into an ICU, how do you expand hospital beds into alternate facilities, whether that was an outpatient facility or something else, how do you turn them into inpatient facilities, how do you create triage areas outside your emergency department to minimize the contact people have with each other. Those things all happened incredibly quickly. And it was really impressive to see how hospitals could respond in that time frame.
Mm-hmm. I've been super impressed because I'm always learning about these hospitals, and I know you are too, but I've been really impressed in talking to hospitals both here in the metro area and throughout the state, how well actually they have planned for something like this. And then, as you mentioned, jumping into a regional planning model. But has that been something that you've been impressed with as well? Just with some of them, especially like with their surge planning, with their anticipation of something. We didn't anticipate this thing maybe exactly, but just the ability to react to something like this.
Yeah, hospitals are always planning for catastrophic events because if you have a natural disaster or a huge accident, the hospital has to be prepared to see significant volume above the volume that the hospital anticipated. So there's an element of disaster preparedness that is always going on within hospitals. I think what was particularly impressive about this, though, is this was not about responding necessarily to an event where something happened and it was over and then we were in recovery mode. This is about how do we manage this pandemic on a go forward basis for however long it takes until we can return to some sense of normalcy. So in a sense, this built on the lessons learned from other types of natural disaster preparedness, but it's really at a different level because it really is a sustained response and a response that has to toggle on to ramp up and then ramp back. And I think that's kind of an interesting thing when you think about the response of our country, because one of the challenges we're having right now is that our emergency preparedness system was kind of built to respond to regional disasters, to respond to a hurricane in the Southeast or an earthquake in a specific part of the country. This is everywhere. And so as we've seen, we really perhaps were not as prepared as we could have been as a nation for the type of response that has really transcended state boundaries and has been in every single state in the country.
This pandemic has shone a light on our healthcare system and also on some conversations that have been ongoing and I would say have been maybe accelerated. But is that something does it feel like that is happening with you, whether it's value-based payments or the need to really take a look at how healthcare is delivered and paid for, which has been, again, an ongoing conversation, but maybe needs to really ramp up?
Yeah, I think the pandemic has highlighted and magnified elements of the system that were already there, but now we can see them in sharper relief. So if you look at the conversation around health equity, and we've seen a magnification of that conversation as we look at how this pandemic has impacted certain members of our community more than others. So that's something we're going to have to lean into and we're going to have to understand and we're going to have to do a better job of responding to. This pandemic has highlighted issues of payment, as you mentioned. Fee-for-service revenue went away. I mean, it just disappeared. And so in that April-May timeframe, right at the time that we needed to resource our hospitals to respond to the pandemic, their revenue disappeared. I mean, not entirely, as you know, but significantly and dramatically, in some cases 70%. So I think that really highlighted a weakness of how we pay for healthcare that we have to address moving forward. But again, those are just two examples of things that existed in the system. The pandemic just brought them into sharper relief. Now the question for us is, how do we respond? How do we move forward to address those issues in a way that prepares us for the future, that takes care of patients today and their needs today, and really helps us to build on the lessons that we've learned.
Hospitals have always been essential partners in Oregon's expanded Medicaid system in terms of payment and delivery, financing. Has the pandemic, again, highlighted how important that is? And then as the state works to plug a gigantic budget hole, does that concern you that Medicaid might be at risk during that time?
Sure. One of the things I'm most concerned about right now moving forward is the state budget and the impact of lost revenue on different parts of the state budget. Healthcare is one of them, but on many aspects of the state budget. And so, I think as we look at this moving forward, it's yes, we need to make sure as a state that we are funding basic services for Oregonians. We have more people who are unemployed. We have more people who are going to be on Medicaid. We need to make sure that those services are there for them. But there's also an opportunity in a time of fiscal crisis to reimagine what we're doing and to say, again, what have we learned from this? And then how do we apply that to our systems and structures moving forward to make them more efficient? Like doing the same thing for just less money over time is not a recipe for success. So how do we do things differently? What does that look like? And then how do we work with our community partners and stakeholders to create a vision for that and then to implement it? So I'm not a fan of just saying we're going to do less, we're going to do the same thing, just we're going to get paid less for it as a recipe for success. We have to think bigger than that. We have to think transformational. And yes, it's hard to do those things in a time of fewer resources, but sometimes that's the time that it's most important to have those conversations.
You have a lot of experience with hospital association work, both at the state level and also at the national level. How has your work with AHA helped you in the two states where you've worked with the state association?
Mm-hmm. Yeah, I'm really fortunate to have to sit on the AHA board right now and to have a really firsthand view of how how hospitals and the hospital association is responding at a national level. It's been the federal partnership through this and the federal funds that have flowed to hospitals have been absolutely critical in this pandemic. The largest source of relief has been the federal government. The state legislature has appropriated some funds for rural relief, and we greatly appreciate those funds. But really, the money that came that kind of saved some of these small hospitals at the beginning came through federal legislation. So I've had a chance to kind of witness firsthand that process of building the case for that, underscoring why it was so important. The other piece that is I guess less talked about but equally important was all of the regulatory relief that happened early on to enable hospitals to be flexible and to respond. All those things we were talking about earlier, creating new inpatient units, creating triage areas, a lot of those required waivers that the federal government had to act really quickly to put into place. And so if you look at how we've responded to the pandemic in Oregon, it's very much influenced and colored by those decisions that were made at the federal level. And so we could not have been as effective as we were in our state response without that strong partnership.
As we mentioned at the top, you're still in your first few months here, and I know that it was and is a big priority for you to work on the culture and the culture of collaboration on the team that you run at the association. So that was ongoing, and then the pandemic happened and we're not even in the office anymore.
Right.
Talk about some of those challenges a little bit as you try to create that culture.
That is a really good question, Dave, because I do care really, I do care really deeply about organizational culture, and that our organization is a place that people want to come work, where they find fulfillment in work, where they find camaraderie in their team, and where they're proud of the work that they do because it serves an important social purpose. And like I said, I was really blessed to be in the office for a couple months at least with the team, but then we had to make this kind of wrenching transition, which a lot of organizations had to make, and figure out what that looked like in a virtual environment. I'm kind of an introvert at heart, so I'm okay working at home, but even as an introvert, like I miss people. Like I miss being in the office, and I miss walking around and popping my head into somebody's office and saying, how are you doing? What are you working on?
Right.
And that's not as organic in a virtual environment. So I feel like we've adapted really well. I feel like people are thriving online, but there are definitely elements that I miss, and that whenever we are to the point where we can be back in the office, I will be really grateful to have that experience again. I think one of the things that has been positive is just asking people and having a group of employees who've been able to make recommendations on, some of the things we can do to try to make connections with each other during this time. We're going to try to have an employee retreat. I mean, how do you have a retreat virtually? But we've got to try these things out until we and figure out what works, because there's not an end date to this right now. And so, like, failure is not an option. We have to create and sustain that sense of teamwork and continue to build that culture, even though we can't be in the same room.
Well, speaking of teams come in all sizes. So Team Hultberg packed up and relocated to a brand new state, and you've got a bunch of members of that team. How's it going for them? And I know that probably is, you feel that pressure that they are thriving here, and this is a strange time for all of us, but
Yeah.
going.
So Team Hultberg actually has not all been in the same place since January. I'm married. I have 3 kids, 21, 18, and 12. And the 18-year-old was graduating this year. So my husband and 12-year-old stayed behind in Alaska while I relocated here in January. And then the pandemic hit. And so I didn't see the 3 of them until from March until June. My daughter was down here, so wasn't by myself. So now 4 of us are down here, and the 18-year-old is enjoying his last summer in Alaska and will be joining us soon. So I will be glad when we are all in the same room again. But again, who would have thought that my carefully laid plans of going back and forth for a few months would fall victim to the pandemic? But we're mostly here now. We're feeling settled. We're glad to be here, and we will look back on this time with I'm sure some laughter at some point. I'm not sure we're there yet, but at some point we'll look back and reflect on this time and find the good in it.
Yeah. Yeah, I think we're all in that same mode, and working hard to make the best of it, and in every way. So yeah, we're in some ways all in this together. Um, what are you hoping for? Last question. Moving forward, what would you say are your kind of parting words for folks inside and outside the organization?
Sure. Well, I'm grateful to be here, first of all, and just thanks, Dave, for giving me the chance to talk a little bit about what is important and reflect a little bit on the last couple of months. I think a couple things. I mean, this is a marathon right now, and so one of the things I think about for our team, and I know that many of our hospitals are thinking about, is resilience. How do we cultivate resilience in ourselves and our teams so that we can continue this marathon? And that marathon's going to involve 2 different buckets of work. It's going to involve this ongoing response to COVID, and then it's going to involve the other things that, again, were part of the system to begin with, that we have to turn our attention back to. So that includes how we pay for care. It includes behavioral health. It includes health equity. So we need to be able to simultaneously respond to COVID wherever the pandemic is, and at the same time turn back to these other important issues and continue to move them forward. So there's a challenge in that. There's a lot of work involved in that. And through that, we have to care for ourselves and our team members and make sure that we have the resilience to do that work. So that's a long way of saying, I think, that we've got a lot of work in front of us, but I'm really grateful to be here, grateful for the team, grateful for the members that are doing this work. And then again, and for the frontline caregivers who are really the reason that we show up every day to try to help them continue to take care of patients.
Becky, thank you so much.